change. Isn't it about time? Today on the Manspace. Welcome to the Manspace podcast. We're your hosts, Doctors Matt Brown and Rob Porter, and clinical therapist Mike Porter. Welcome, spacemen. I know many of you have been waiting with bated breath to find out, Rob, what happened with the colonoscope? Well, today we find out. Today.
Was Dennis Quaid involved? I think when you publish the video for this, take some of his shots of your inner colon and put Dennis Quaid in there, like
maybe that'll be our thumbnail that I basically never do anymore, or I'll make the laziest. I love doing thumbnails off of that are AI generated. I think they're hilarious. And everyone's like, people get mad at that. It's like, don't do that. It's like, it's freaking funny. For some reason, this guy's hand is melding into his other hand. No, I was going to say this whole process. Here's what I'll say about getting a colonoscopy. I actually feel like, I understand that not eating for 2 days is like, well, this kind of sucks.
Uh-huh.
But actually for me, after for sure after 24 hours, it's like my body shifts into like, okay, I guess we're not eating anymore. Mm-hmm. And it's just like, you stop feeling really hungry.
Yeah.
So actually when I thought I was going to have like careful diet coming out, but they're like 3 times I got asked, so what are you eating when you're done? I was like, do I need to eat something special? Do I need to be careful? Like, no, just eat whatever you want. Go get a big old steak. I was like, oh, okay.
I was going to say, I think that's what I had planned.
And then you got told.
It was a cheeseburger or something.
And they told you not to?
I didn't feel I didn't feel right yet. But I had also had like diverticulitis for a couple months before that. And, yeah.
Apparently I have diverticulosis.
Yeah, I think we all do at this age.
Yeah, I was going to say mine's mild, it says, but they just said keep making sure you eat lots of fiber.
Yeah.
So that it doesn't turn into diverticulitis. Mm-hmm. But I also had a small polyp, if anybody's wondering.
But no results yet?
No results yet. So depending on how the results of that polyp come back or whatever, then I may have to do it in 7 years or it'll be 10 years.
Well, hey, really gave you some leniency there, man. I did it when I was 30, late 30s, at least. Or at the old, whatever. You know what I'm saying. I can't remember what I'm trying to say, but it was like 7 years ago. So, but they told me they found a small polyp that was nothing. And they said every 3 years.
Yeah, I don't, it feels like
ramrod every 3 years.
It feels like there's a real difference in how things play out afterwards. Mm-hmm. Like the stuff you get told. And so I was like, oh, okay, cool. Like, so I was like, Becky's like, well, what do you want to eat? I was like, I didn't think about it. Let's just go to Chick-fil-A. It's across the street. Mm-hmm. But I ordered extra. It was delightful. But
no
mental thing.
No slip and slide poop afterwards, huh?
No. Everything it took me I probably didn't poop again for another day and a half, 2 days maybe, because it was like there's nothing in there to poop.
Yeah.
But I told Becky, I was like, I don't see what the big deal is. Like, it's not, I thought that would be like very uncomfortable. Like the cleansing process before. It wasn't. It was just like, you drink this stuff, you feel a little bit bloated because you're putting so much liquid in, because you drink this, you have to drink 16 ounces of this disgusting flavored stuff with Gatorade so it doesn't taste so bad. And then you have to, within an hour, drink another 32 ounces. Mm-hmm. And then for the next hour and a half, you're going to go, I went poop like 3 times, but it was fine. It was just like you sat down and there it is, like it wasn't painful. It wasn't like, and I have a bidet, so it was fine. And then like Mike looks so bored by this colonoscopy conversation. So is every listener right now. Oh my gosh, Rob's talking about how many times he pooped. But it was like,
Did you have people tell you that it was a horrible, like that the prep was horrible?
Yeah, I feel like everybody's like, oh, I don't want a colonoscopy. Oh, I hated mine. I was like, why? When I got there, they check you in. The woman who did my IV is like, you could tell she was a student or whatever. Mm-hmm. And man, I was like, use that vein right there that's really big and obvious and a totally straight line. But she picked this weird one right next to my knuckle. And it was like, it was so painful. It was like she was slowly cutting me open. And I was like, oh my gosh. And I'm staring at her. I was like, I mean, you're not there yet. And then, but then they put you to sleep. Like they wheel you into the room. And I was like, how weird is this? They do this all day. Mm-hmm. But they wheel you in and the guy's like, so we're just going to give you some stuff. He's like, you'll probably start to feel it within like, just a few seconds. I was like, oh yeah. And I could feel it. And he's like, if you just fall asleep, I was like, cool. And then I was out.
Yeah.
And then I did the endoscopy. So my mouth was like crammed open.
Oh yeah.
But then they're just like, Rob, you're done. I was like, I'm done. And I sat there trying to force myself to see the clock straight, but I couldn't because it's like waking up from a really heavy nap.
Yeah.
But dude, sedated sleep is the best, man.
It's like instant.
It's like time, like there's this space of time where the whole world went on without me. Mm-hmm. No, it's just so fascinating, dude.
And it also went on inside you.
Hey, you mean within you?
Yes.
You really missed an opportunity there. I was trying to turn on our screensaver behind you, but it's just not happening. Sorry, buddy.
I always wonder, with doctors that work with certain body parts, like there's got to be some joking going on.
Oh, 100%. I think I've told you guys that when I was in high school, for one of our young men's activities, they took us to surgery. Like we were standing in the room next to the surgeon. Mm-hmm. I was standing next to the anesthesiologist, and the surgeon, they're playing Metallica or something. I was like, what? Because apparently they said the only really hard part was like the opening and the closing that's when they don't want somebody in there or something like that for whatever it was. And they were, okay. I just missed the cracking open of the sternum. I was like, oh
yeah.
But the doctor kept slapping. They had like this, like stuff on the leg for clean. He kept slapping the leg and going, we got a fat cheesy one. And I was like, what? But then it occurred to me, it's like, well, they have to dehumanize these things. So it's not like, and this is Susan and she's a mother of 3. And if I screw this up, then those kids are orphaned, It's like, so it's just a piece of meat. But I remember it was the first time I was like, so like, can anybody just be a doctor then? Like this guy's a jerk who listens to Metallica. So I'm sure there are jokes that's like, because one woman, I heard the woman next to me and they're giving her results. She's hilarious. She's like, so any word on that coffee? You guys making any coffee? She's like, I'm not trying to be a pain. It's like, sounds like you are. And they basically found nothing. And she was real disappointed in that. Mm. But the guy's like, well, we kind of saw this. He's like, the prep wasn't great. So there was still a lot of stool. So we couldn't really see everything we wanted to see. I was like, man, that must have been not pleasant for them.
Yeah.
Like.
I didn't even think about that. People that don't adhere to the
I was going to say, does that just mean she wasn't paying attention and didn't
I bet she skipped certain parts. Like they say, if you've taken the prep stuff and it's not a certain consistency or a certain color when you're like, but before you go into the hospital 2 hours before, you have to do an enema. And I'm sure she's like, it's fine, but whatever it was, the whole thing is like, Meg and I were making tons of jokes. It's like, what if they forget and use like the same camera or don't clean the camera before they go on the other end? Like at least go mouth first and then butt second. Like, or if it's like it's like an assembly line, they're just like wiping it off with a Clorox wipe. The next person, Like.
Oh, man.
Anyway, but
any man that we talked into seeing the doctor last week is now not going.
Well, it was worth it. I guess. I don't know. In the end, I went to do a physical just yesterday. Mm-hmm. And seriously, I sat there thinking, what am I doing here? The most she can tell me is that my good cholesterol was just a little bit low. And she's like, that's just genetics. When it's low like that, we'll usually tell you to exercise more, but don't you already exercise a lot? And I was like, yeah, usually around like 90 plus minutes a day. She's like, yeah, that's way above what I would usually tell people.
Yeah.
And she's like, so maybe lose a little weight. I was like, okay. I mean, I don't think I'm in an unhealthy weight, like, but it's like, what am I doing here? I get why it's like, if you're healthy, what are you coming? It feels like when I get clients coming in and they're like, we're good. I'm like, then why are you still coming?
Well, it's like I was telling you last week when I went in to have the physical, and they're like, why are you here?
Yeah.
I'm like, because isn't this healthy?
Yeah, isn't that what we're supposed to do?
Well, I guess we'll just look at you.
That's what this was. She's like, your blood work from last year looks good. I guess we'll find out what it says this year. I was like, okay. You could have told me in advance to do some blood work, but you didn't.
So you got to come back for the interpretation.
She said they wouldn't even start checking my prostate till I'm like 55. I was like, what? Okay. I thought they did that like standard when I was like 15.
I never had that.
No, just the turn your head and cough thing.
Which they don't do anymore, you're saying?
They did that. I got a turn your head and cough probably like 5 years ago. But then this doctor, she didn't even listen to my breathing. She's like, you got a really slow heart rate. Do you exercise a lot? I was like, yeah. She's like, good job. I'm a specimen, guys. That's all I'm telling you. But I'm just making all sorts of noises. Today feels like the kind of day that even though there's a topic, I'm like, are we going to get to it? Or are we just going to talk about our favorite shows?
Well, that was Mike's topic.
I know. I will say, have you guys started watching, did you watch The Bear?
No.
Dude.
Isn't that on Apple TV?
No, it's on Hulu.
No, it's FX.
Okay, another service that I don't have.
It is.
Well, I think it's on Hulu.
It is on Hulu. Mike, can you not hear us?
No, I can.
I just said it's on Hulu.
You're I said FX, I don't have Apple TV or Hulu.
Wow.
But
I didn't hear you, Rob. I heard Matt.
Oh, I see how it is. That one's amazing. You should watch it. We're also watching Only Murders in the Building, which is coming out 1 week at a time.
I don't know what happened.
You don't like it?
I watched season 1, part of season 2.
It's fun.
I'm fickle.
I watched seasons 1 and 2.
Start with go on 3 and 4. Great.
I think I need Martin Short in like small doses.
Yep.
I think they intentionally in the show, at least in season, are we on season 4, 3 and 4? I think they intentionally poke fun at that everyone's like, I need that guy in short doses. So I feel like, yeah, I get it. I don't know. It's I just think it's a fun show.
It was. Well, I'll say this. I started watching that when I was also watching Severance and that Outer Limits show.
Yeah, I got mixed.
So it was like a real weird.
Yeah.
That Outer Limits show, dude.
Yeah.
They came out with a new season.
I know. I didn't even
make it through the first episode of that. I was like, this show's just weird, dude.
Yeah, it was weird and getting heavy. I was like, I'm not into that. I don't need to have heavy after a day of heavy.
I love Alone, dude.
Alone?
It's on the History Channel.
Is it like reality?
Yeah. They they take
Matt just wants to be alone.
10. I think it's usually they start with 10. Maybe that's it. No, it's they take like 10 survivalists that audition for it, but they can only bring like a certain amount of items out. I think like 10 items out, and then it's like they drop them in some super remote place, usually in Canada, or I think there was one in Patagonia. But and then it's just like whoever lasts the longest gets $500,000. But they have to like document their whole journey, and yeah, it's just interesting to see what happens when you spend that much time alone and with that much hardship, and like previous seasons I was kind of like, I mean, it's hard, but you kind of have this misconception like, I could do that. But yeah, the more I think about it, and especially like this last season, just seeing this dude like kill a moose and freaking like dress it in the field and hike it all back to his camp like 3 miles away while a bear's trying to eat it and like all this stuff. And
jeez, dude, I'm
like, and he's like starving to death while he's doing it. I'm like, how in the world do you do that?
Especially when you don't have to.
Like, I think that's the thing, you can tap out at any time. You got this phone, and
Like that's I don't know. Like I don't know if I could do it if I had to, but if it's just like for the sport of it,
yeah, it's crazy.
I don't know. But watch this. Speaking of hardship, I mean, I wish I should have had like maybe I'll insert it like a boing. Speaking of hardship, the topic today, and maybe this is just because I've been thinking about this more and more. The topic today is that there's no quick fix. So here's why this has been coming up. Now, to start this, everybody should know, all 37 listeners should know. They probably already do because they probably already know me. They should know that I am, maybe I'm a skeptic. I don't know. I think I could say that. So in the therapy field, we've mentioned this on the show before, there are trends in diagnoses and there are trends in modalities or approaches to treatment. Everybody knows CBT, cognitive behavioral therapy. And many people now know a treatment that has been a trend for probably the last 5 years at least, EMDR, which I'm always like, it's eye movement desensitization and repetition.
And reprocessing.
Reprocessing. Dang it.
It's okay. It's a clunky name.
Sure is. That one became the treatment that everyone was doing for a while. And it was, I would have clients who were like, they're like, one woman signed up to go do EMDR, and I was like, go for it. I don't do that treatment. So she comes back and I was like, how was it? She's like, dude, it was amazing. It was like everything shifted. It was like, awesome. 6 months later, I mean, not even 6 months later, that same session, I was like, we're talking about all the exact same stuff. What shifted exactly? Or now the new one is IFS, which cracks me up that this is the new one.
Do you remember when Dick Schwartz gave that presentation on it? This was like 2012 at AMFT, and he gets up there. He's the guy who developed it, obviously, for those who don't know. But like, he gets up and he's like, well, guess I'm good enough for you guys now, because they gave him a plenary talk.
That's so funny, because I was going to say
he developed it like way before that. No one cared. And
when I learned it in 2005, it was like, and then there's this theory, IFS, internal family systems. I mean, it's kind of a systems theory, not really, but it's also very it's, everyone does some, this is like this in all theories, there's parts in all theories, but it's parts therapy. But now it's like, this is the cure to everything. And all my clients are like, I need to go get IFS. I'm like, do you? Did you read that in a magazine somewhere? Or every therapist is getting trained in it, which cracks me up. I'm like, you don't even know systems theory, but you're getting trained in IFS. But I get annoyed at these things because it's like people have this belief that it's going to change everything. And there's a part of me when everyone says we're having these amazing outcomes, it's changing everything. And I look and think at society, I look and think, is it changing anything? It seems like we're all still idiots. Not to say that you can't be healed from trauma and also still be an idiot, for those of you who feel like I'm still an idiot even after being healed from my trauma. Probably that somehow seems insensitive. Did you ever see that episode of 30 Rock where what's his name? I want to say Damon Wayans. Tracy Jordan.
Oh yeah.
That when him and Charlie Sheen's girlfriend, whose name I can't remember, they start protesting. Idiots are people too. And they have like their protest is totally disorganized and misspelled, and because it's like, because we're idiots, but it's like, we're people too.
We're people.
Anyway, so tell me what you guys know, I guess we'll say. Well, tell me your thoughts on that, about the idea first of like, people, when they come to therapy, I get a lot of people who basically want everything exactly the same. They don't want to change anything, but they want their problems gone. Do you believe that's possible?
That your problems can be gone if you don't change?
Not necessarily even that you don't change, but it's like, so let's say, like, for example, let's say that your problem is depression. And so you come in and we talk about, maybe CBT type stuff. And so we talk about cognitive distortions and challenging your thought patterns. Is that enough? Mike.
Enough for what?
I thought for a second Mike was falling asleep.
Wait, what was... I can't remember what movie
is that enough to like solve it?
Yeah, we'll say that. I mean, that's not to say that that's easy. You said no because it's depression?
Yeah. Like, if you're dealing maybe with some situational depression, maybe. But, I mean, I have times where seemingly nothing in my life has changed, but I am in a depressive slump.
Yeah.
Like,
but well,
like
I mean,
there's not necessarily a thought process or a thing. It's just my brain.
Mm-hmm. Yeah. Like, do you think? So I have clients, and there's research on hypnosis that shows that hypnosis can be very effective for treating specifically tobacco use and cessation.
Yeah, and also, do you remember Michael Yapko?
Yeah.
You were at that training. I think it was TAMFT. He showed that video of that girl who had like paralyzed arm or something. He was talking about like people going under the knife with no pain meds. Based on being hypnotized with no pain. I'm like, that is...
Right.
You should have done your colonoscopy like that.
Just hypnotize me. But then I've had clients who said like, well, can't you just like hypnotize me? And then like, this is kind of gone. And and first of all, I'm like, no, I don't. A, I don't do hypnosis, but B, no.
Yeah.
Like I don't, in my mind, I think I don't believe in a fix that is so quick that it's like, it required no effort out of me. It just happened. And the reason this comes up too is because I've been reading and seeing more and more about psychedelics and like ketamine assisted therapy. And I read these things that people are having these life-changing experiences. And I've wondered, I don't know enough about it yet. And I kind of feel like nobody does yet.
Yeah.
I cannot deny that people are saying, man, that was, like I gained insight and had experiences that I've never had before.
Yeah, and I see about LSD.
Well, this is what I wonder, like, because LSD, you say people say that about LSD?
Yeah.
Yeah. Well, and anything you could put in that psychedelic category. So it could be ketamine, or it could be LSD or shrooms or, I don't know, fill in the blank. PCP. Do we do that with anything anymore?
That's like in the old Dare song. PCP. Yeah, you know me.
So what I wonder is, I don't know, like, it's kind of funny. I guess I'm leaving myself open to this idea, actually, even though I said there's no such thing as a quick fix. My thinking is there isn't. It's kind of like when people do these assisted treatments, I think it's really cool you had these outcomes. I want to see what happens in 6 months or a year. Now, it's not enough to say that, I mean, there are people for sure who will do treatments over a long period of time. And there are follow-up treatments and things like that. And all these things in theory should be done underneath the supervision. In fact, I think they have to be, but I shouldn't say in theory, under the supervision of like a psychiatrist who could administer the medications. But it's like what I wonder sometimes, because I've had people in my office who said, I did this and man, it was amazing. And I think, but everything seems the same to me still. Like, as the outsider watching, I understand you had this experience, but everything still looks the same. And we're still talking about the same things. And so it's not to say you didn't have the experience. I think, I don't know what to make of it yet. I guess that's kind of what I'm saying. It's like when we would do these workshops for like weekend retreats, And we would have couples that would say like, dude, that changed. Like our marriage has never been like this. That was amazing. And I will say, that's awesome, man. It's been 2 days.
Mm-hmm.
Go see a therapist now because
Mm-hmm.
you're nowhere near done. You just opened up. We did a rapid opening of stuff. Now you got to go do a ton of work.
Yeah.
Because otherwise it's normal life sets in. Or another comparison is kids who go to like at-risk youth programs.
Mm-hmm.
They go out in a wilderness program and everything's amazing. And then normal life sets back in with the normal family patterns and routines and everything just kind of goes back to the way it was. So in short, I guess maybe you guys have read more than me. Probably everybody reads more than me. If it's in a movie form, I'll watch it. But read more than me about like psychedelics. I feel like because I watch the patterns of humans in general, but also the patterns of mental health, I think, is this just the next thing that we're saying this fixes everything? And then kind of like with meds, it's like, look what we're doing with SSRIs. And then we have this study that comes out that says actually nothing.
Mm-hmm.
It's all placebo.
Yeah.
So it's like, I don't know what to make of this yet. It seems too quick a fix to me.
Mm-hmm.
But maybe I need to be smacked around and say, because I've heard clients say it was really meaningful. And I think that's awesome. But are the behaviors changing?
Mm-hmm.
So I don't know what I want you to respond to there, but respond. Correct me, fix me, do it quick.
Did you have any thoughts, Mike?
Yeah. I mean, a lot of this, to me, the way you're setting it up, Rob, is just reinforcing the idea that there is no quick fix.
I know, and I'm actually trying to avoid that because I'm trying to be open to the possibility of what if there is, and I'm just too skeptical because so many people have had so many meaningful experiences.
Right, but that's just it. A meaningful experience is only as good as what you do with it.
That's the part that I think is so annoying.
Right,
it's like
so here, watching Scrubs today.
Obviously, it all comes back to Scrubs.
Yep,
ever though,
always does.
Favorite TV show ever?
Yeah.
Like it tops like Friends or Seinfeld or Arrested Development?
Yeah, because for starters, it did things that none of those shows were doing.
Wait, what about like Newsroom?
Nope, still better.
What about Severance?
I never saw Severance, but I would say
what
still
about
better.
Patriot?
Now, if you compare it to Ted Lasso, I could say Ted Lasso maybe, except I haven't seen season 3 of Ted Lasso.
Michael, I don't like you non-committal TV watcher.
I don't know what to tell you.
That's your thing, man. You watch TV.
I do.
I mean, it's also my thing, but
so I was watching Scrubs.
Yes, fine. You can speak about something.
Elliot.
Turk.
Turk was saying to Elliot, like, do you think we would still be doctors or whatever? And she said, Turk, you get excited about it. Every time you do a surgery, you get excited. It could be the 100th time you've done it, and you love to teach it, and you love to do this. And she goes, so yeah, you'll always be you'll always be a doctor. And she goes, for me, she goes, yeah, I like the investigation. I like finding out the information. And she goes, and finding it is kind of like getting a good piece of chocolate. I enjoy it, but then the chocolate's gone, and I'm left with the memory of the anguish on my patient's face. And to me, that's kind of what you're describing. Like someone has this insanely powerful moment. And I think, sure, but is that going to be enough to hold on to when the memory of the other thing sets in? If you don't do anything, then no, it won't be. And that's like, I had a client who actually did ketamine treatments.
Uh-huh.
And he did them under supervision. And I asked him, and he said, no, there's a lady there with me to kind of talk through things with me while I'm in that state.
Yeah, it's supposed to be processing, not just like get high.
Right. But then he would come back and we would still he would take these things that he had, found and kind of opened up during his ketamine treatment. And then we would go deeper with it. And I think, he's doing yes, he had this really profound experience. And then he's coming to me and saying, help me understand and integrate this really profound experience so that it's not a one and done thing. Because he knew it'll be one and done if I don't.
Yeah, in that respect, it is like, hey, this is an opening, a door opening, but you have a lot of work to do once you get in there.
Right.
Although there's a part of me, and this is because I've never experienced it. And so someone who has could say you'd have to experience to know. But I have a hard time trusting the way my brain works in that like thinking, well, was that profound because my brain was altered? Or was that profound because I finally broke into the third eye? Does that make sense? Is it like this profound insight, or was it a drug-induced insight?
To it.
I don't know either, and that's what
because clearly it's a drug-induced insight. Like the fact that the insight comes while you're on drugs, how else can you define it as anything but a drug-induced insight? That doesn't make it inaccurate.
Well,
but it is a drug-induced insight.
So this is what I think is interesting. I was telling Matt about this a little bit, Mike, during lunch, that Becky just read this article in the Rolling Stone about ketamine or psychedelic assisted treatments, and said that so many people are reporting finding God in this process. And one of the things that she said that I was like, because I kind of sat there thinking, I have a hard time when it's like we found the loophole. And one of the researchers that they were interviewing apparently said the problem with this is so many people are treating this. He didn't say like a loophole. He said they're treating it like essentially they're storming the gates of heaven. It's like you don't have to be a good person anymore. You just take the psychedelic and you find God.
Have to get high.
Yeah, and it's the loophole, like that. I thought, well, that is an interesting way to put it, and that's what I think where my resistance comes, which is probably also at least partially due to ignorance. I'm confident in my ignorance in that category. That's like I don't know fully. Mike, I don't. Did we ever actually do that episode? Because our niece is a physician's, a psychiatric nurse. No, psychiatric. Well, she's a physician's assistant,
but she's
a psychiatric one. Yeah, she works with people through ketamine assisted therapies, and she's like, I've seen some really amazing, profound things, and I'm like, I want to see that because I've, my friend Austin, Matt, Austin. He does intensives, like people would fly in to where he used to work for 1 week, and they do these really intense, really profound things. And I've watched clients do that in intense weekends. Really profound things come out that I'm like, yeah, I don't think that's going to stick. So and I don't know that anyone can convince me different. I don't believe in a quick fix. I just don't think there is one, period.
Well,
and it's not to say that ketamine assisted therapy is a quick fix. It just seems like it's being plugged that way.
So we were talking, I was talking with some guys the other week, and AI came up.
Yeah.
And AI seems like a quick fix.
Yeah.
And so we kind of looked into it in like the religious context of it, right? Like, how does AI fit in religion and stuff like that? And specifically with our church, right? They've released a statement saying, hey, this is, it's kind of where we're at with AI. And one of the things that was interesting and I think is accurate is, look, there's no way to replace doing the work. Like AI can't give you what you can get by praying and by like actively seeking God. And so I think, yeah, if that's what you're looking for with like ketamine, no, same thing, right? Like, no, at some point you have to do the work. If it functions as a door, okay, sure. But at some point, like, just because there's a door doesn't mean I walk through it, right? You can lead a horse to water, you can't make him drink. And to me, that's like, that feels like what is being described is, I think, yeah, you're seeing these really profound things. You've brought them to the water. Are they going to drink it, or they're just going to sit there and be like, wow, this is amazing. Who knew there was water here? Well, yeah, we helped you get here. Now do something with it. I don't know. That's kind of how it makes sense in my head.
Yeah, I don't have any experience with the psychedelics.
Me neither. I just thought.
Well, that's where I feel like
this is all just me wondering out loud, kind of.
Well, if we talk about psychedelics, I don't know that I'd have much to offer because I haven't really researched it enough. I've had clients do assisted therapy and things, and with varying degrees of success, I guess. But yeah, I wonder, like, I think that it's clear that there are a number of different things that can produce a successful experience,
mm-hmm.
and that can produce, like, maybe a window into possibility and change. And I think oftentimes when that comes in an unexpected way, it has a certain magic to it, right? You're like surprised by it.
Yeah.
And that's where people say things like, I had no idea that I felt this way, or that I believed this, or that, and I think that those are really important experiences because they do provide really critical elements of change, like hope and expectancy and
mm-hmm.
Motivation and all sorts of things. But yeah, absent of like some way to kind of replicate that experience,
which people do.
Yeah,
they'll just decide they go to. There are people who say, like with ketamine, for example, or with psychedelics, that they essentially join like a religion that's basically like, and our weekly sacrament essentially is shrooms. Mm-hmm. But anyway, go ahead.
I would wonder though, like, and I don't know, because I'm sure there are a category or a certain percentage of the population that does it that way, whatever the change
mm-hmm.
is, and they really feel like it's sustained, and maybe they're in a path that is leading to like more and more growth every time they do it. And then there's probably the rest of us who kind of cycle through, different forms of change and ideas.
Yeah, attempts to change. Yeah,
that I think play off of, like, to your point, Mike, where if the determiner of success was, did we produce something? Then yeah, with AI you could say, yeah, it did.
Yeah.
Mm-hmm. Like, I produced something external, right? But if the product is like an evolving and growing, experience for a human being, then that's probably a very different pathway. And we have not evolved for quick fixes. But that book I was telling you about before talks about the scarcity loop that our brain evolved with, and it's like opportunity, this really weird term, like reward prediction error, which is basically like unexpected outcomes,
mm-hmm.
and then quick repeatability. So we're excited by, like, all B.F. Skinner's like operant conditioning stuff, where it's like, if you give like an interval reward system that's like a random interval where it's,
right,
I don't know when the food pellet's coming, but it does come, then I'll just keep repeating this behavior. It's quick to repeat.
Yeah.
And then when the reward comes, it's like, this amazing experience. So I think when you pick up a self-help book, or you try a new treatment, and maybe other things that have worked before aren't having the same effect because the effect or the outcome is predictable now. So it's not as rewarding because it's not novel anymore. Then I find something else that produces a novel outcome in an unexpected way, new opportunity, and I can keep going back to it for a while, but eventually it's going to start to kind of wear down.
Yeah.
So, but I don't think that people that are I think you can get too attached to that process and think, I'm really, like, this is the new thing.
Yeah.
And then feel let down, and then need something to lift you up again, and then feel let down. But I guess I would argue some change is still occurring through that process, but maybe the illusion is that at some point you're going to find the thing that solves everything.
Mm-hmm.
So if we're trying to save people from like the elation and deflation cycle, then we would say, hey, you're not going to find it, but keep doing what you're doing, because you are learning new things, you're changing along the way, and maybe everything that you do is some semblance of what you did before, and it just reminds you of the things that worked. And so that keeps you engaged in a process of growing and changing. But if it's more like, I don't want to do any of that work, just give me something simple, then I think that's probably just a lot of like sitting in a deflated place hoping that something will happen and nothing happens.
Yeah. And I do think, to clarify too, I think there are some people who are like, I don't want to do the work. Just tell me give me the thing that will work. I think there are some people who feel like I've done every single work I can think of, and I've lost hope. Maybe this could be hope. And that's, I do hope that I think those people are more likely to say, I'm willing to do the work. I just need the door that would open, but no door was ever opening. And I think, I think this is on my mind too, because it seems like right now there is so much out, whether it's AI or psychedelic treatment or Ozempic, or another one that just came out. Semaglutide or something like that.
Semaglutide?
Maybe.
That's like, I think that's the common element of all of them.
Yeah, this one is, it says it's another one of those things, it's the same GLP-1 or whatever it is.
Pronounce the thing different. Hey, check it out, we got this semaglutide.
But I think I see those things too, and I feel like those things for sure have totally helped a ton of people. But at the same time, it feels like the loophole. It feels like, wait a second, you can just do whatever. This thing shows up, it's like, problem gone. It feels like, now I understand with that one, it's, what's interesting is, problem gone as long as you stay on this thing forever. Because if you stop, it's all coming right back. And that's kind of what I'm always waiting for. Like, this is all so new and so fast. Everything comes out so fast now that it feels like, let's just wait and see how this all plays out. Because I just feel like, I don't know. I am 100% positive that IFS will die out. It won't die out in terms of like no one does it anymore, but it'll become like, oh, you remember back when we were all doing IFS? Yeah, I'm not doing that anymore. And we'll be on to the new thing that somebody else came up with, and they're now our guru. We're all just chasing around. It's like that movie Life of Brian. Like, Jesus died, and they're like, well, we need a new one. So they pick Brian. It's such a it was such a funny show. I felt bad watching it growing up because I didn't realize it's not really about Jesus at all. It's about humans and the way we interact. It's like, let's just find a new Jesus. Anyway, so I don't think I have an answer. I will say, I think anything, it's just like a relationship. You're going to feel all these amazing things, and then sure, but it's going to take a ton of work to actually make this be something that you want it to be.
I think you're right, though, that it is like, we probably all are much more likely to just simply identify and treat symptoms than we are to have some like fundamental heart or paradigm shift that dramatically alters the way we do everything. And but I do think there are a lot of modalities of therapy and other things that will say, unlike the other things, this is a more foundational shift, and maybe it has a better chance of providing that if people take that opportunity. But
right.
But I think that kind of change is just really, really difficult, and especially, like you're saying, when we live in a time where there's just an endless and overwhelming amount of like problem identification and solution generation going on, and all really to kind of serve the purpose of making more money.
Yeah, well, we do it too with relationally. It's like, well, the problem was this person.
Yeah.
And, I've talked to clients recently and said, they're like, well, it turns out actually that, this person's a covert narcissist. And I will actually say, just so you know, there is actually no such thing as a covert narcissist. It's just something we made up.
Yeah.
And actually, if you look at the symptomology for that, it actually looks a lot like other different real diagnoses that exist, like even borderline personality disorder. And so it's like, let's be careful to not say there's a problem.
Yeah.
Now, honestly, I'm saying this, and I'm not actually speaking because I think most people are not in this process to just find a quick, easy fix. I do think when I've seen it, it's most people. It's like I feel like I've exhausted every avenue I can think of. I think it is what you're describing. I don't want to see the deflation of hope. It's like another thing didn't work. It's like it can be very helpful,
Yeah.
but it's going to take all this other stuff. So like what you're talking about, Mike, where it's like, yeah, someone says, okay, now we pulled this out. We need to go process this. Now we pulled, it's like, yeah, you have work to do. This is just a thing. The same thing was true of medication. Any research on medication always showed that it was most effective when paired with therapy, which means go do work.
Yeah.
But
well, and like you were saying at lunch, I think it would probably be helpful to say like anything you find to change behavior and relationships and all of that. Maybe look at it like it will account for maybe 30% of the change.
Yeah.
Like 50% of it maybe is just it's going to be what it's going to be.
Mm-hmm.
Maybe the other 20% is like situational and
whatever circumstances.
Numbers, but
yeah.
Maybe it's more helpful to look at it like this one thing did account for 100% of that 30% that I can do something about. It felt like a big shift in that category of change, but I still have a 50% set point and 20% situational that right now I can't do anything about. But I think that's still framed that way. Maybe could be exciting, and but if it's framed kind of as like a cure-all,
right?
Like disappointment and disillusionment will follow,
right? And then it's one more thing you lost hope in. Mm-hmm. And I do think it matters too to say, just like when I tell clients whether good or bad, don't make reactive decisions. Like, sure, you're really feeling the love now because it's been a good 2 weeks, but you guys were filing for divorce a month ago. Don't go have a baby right now. Like, don't go get pregnant. Give it some time for this to settle in and the honeymoon to wear off. Or the opposite being, yeah, you're both really angry. You don't need to say we're getting a divorce right now. Just give it some time to settle back down. And you can make decisions when your head's a little more clear. So even if you have really good outcomes with any of these treatments we've talked about, whether it's ketamine assistant or IFS or whatever, it's like, cool. But that's just saying, okay, what do I do with this information as I incorporate it into all the other information I already have? Yeah. Don't say this is it and go running off full speed. Like you're going to run into a wall probably. So it's like, we'll slow down and incorporate the information because it is like what you're saying. It's going to be a number of factors that go into this. And you should be happy if you find a relief you've never found before. It feels like that's good. That should help you say, okay, now that I've found the relief, how do I get my head to think differently inside of this space? Because before I wasn't able to. That's very different than saying, I found the relief, there it is. That's it. Yeah. It's like, no, that isn't it. That's just the thing that says, okay, I can think.
So that's kind of the thing to me, like thinking about EMDR and even, the work I did with this client who had done ketamine treatments. All of the stuff, like with EMDR, it's a method for processing past trauma. And that's helpful and necessary, right? Because oftentimes our past gets in the way. And with the ketamine treatment, like the stuff that was coming up was stuff from this guy's past. And I think, right, part of what he wanted and part of what I think, like this is kind of where and admittedly, I'm not an expert in solution focused therapy.
Isn't everybody though?
But it feels like, yeah, all you're doing is giving it a Band-Aid. Like what happens the next time something traumatic happens? Yeah, I processed through that one, but I don't know how to handle the next one. And so some of it, right, like that's what I appreciated about this guy is he was like, okay, but how does this thing that I've uncovered relate to what I'm going to run into in 4 months.
Yeah.
Because I want to make sure that if crap like this comes up again, I'm more equipped to handle it than I was, because I don't want to have to go through this again. And I always appreciated that. But for so many people, right, it's the kind of phenomenon, it's great. Like, everything's fixed. Right. Everything's fixed from 6 months ago. But those same patterns exist because the pattern didn't go away. You just processed the event, not the pattern. And so if I'm constantly tripping over the same thing, knowing that I'm tripping over it's great. But if I don't do something about that, if I don't, if there's a loose board on the floor and I trip on it every time I come into the kitchen, well, knowing that there's a loose board there doesn't do a dang thing. I got to fix the board so that I quit tripping on it every time I come in the kitchen.
Yeah. To your point too, I think.
Your point well taken.
What?
Your point well taken.
Point well taken. I think if you, maybe a lot of what people are talking about when they say something fixed it is like I had a new insight.
Mm-hmm.
And if you think about where insight is located in your brain, it's like the most newly evolved portion of our entire being that operates only when we are in a calm state and rational, which is how much of the time, right? So
yeah,
and I don't think that that's the only source. I think sometimes people have insight or they have an experience, like you're saying, maybe a deep physiological experience or a deep emotional experience, but like your whole self has to kind of like map that route multiple times to start to like learn it and orient itself towards it. And so like the deeper work, that just takes time, that takes repetition, that takes engaging yourself on multiple levels, physiologically, mentally, emotionally, spiritually, and I think we rarely tie all that together. And right now we just have such a heavy information centric experience, and insights can be very addictive, right? Like, I haven't thought of that. I can relate to that. Now I see this differently, and it's just like almost like a social media, feed. I'm just like scrolling through and generating all of these ideas, and if they don't permeate on a deeper level, if you don't sit with kind of like maybe a couple primary sources, it just makes me wonder like how deep is the change going. But I also think when you've experienced deep change, it is important to continue to expose yourself to those same things more in the form of an insight. Like, I have to be reminded daily of these concepts. So it feels good to read it in a new way, same idea, but it speaks to me differently, and it's like one more confirmation that this is an important thing to focus on. And I think that's why sometimes you see quotes that are like, duh, and people are like, oh, this is so profound. It's like, it's not really profound, but the experience you have with remembering something profound is profound.
Yeah.
And I think you just like have to have regular exposure to it.
So just to re-emphasize something Matt just said, you do have to continue to expose yourself. I stopped listening. I stopped listening after that. I mean,
expose your innards.
I think it's interesting.
Butt can.
Go get your colonoscoped. I think that's kind of in my mind, this kind of take home message is like, there's a lot of factors that go into actually something changing and you changing. And it could be insight. It could be repetition of insight. It's often mixed with insight plus discipline, any number of things. But to just say, I found the thing, I guess I'd say temper your expectations. Like, that's the word I'm looking for. And then come back next time and catch us on the Manspace, because your kiss is on my list. I don't know why that's the thing I came up with.